Well, huge thanks to Barbara and Alison, who have been wonderful members of the team and have shown enormous courage in telling us their truly heartbreaking stories. And I'm now delighted to welcome the co-chairs of the mental health subgroup, Tina and Kelly.
Hello, my name is Tina.
And I'm Kelly. We're both co-chairs of the mental health and wellbeing subgroup. Although we were members from the start, we only took over co-chairing in the summer because our two predecessors both had to step down for personal reasons. We didn't really know each other at all before this experience, but we found we were able to work really well as a team, and I never thought I would spend so much time with the vicar.
Mental health was chosen as one of the 3 issues the PTC would major on, because if you live in poverty, you are more likely to be mentally unwell. And if your mental health suffers long term, then the chances are you can't hold down a job, so even if you were relatively well off before, mental illness means you are more likely to slide into poverty. Also, if you are mentally unwell, you're far less able to negotiate the system, to be able to make claims for benefits you're entitled to, or to appeal against unjust rulings. Add to that, the system is so soul-destroying that anyone's mental well-being is going to be badly affected by it.
Our first task as a subgroup was to talk to lots of organisations and to do some mapping of what is provided for some people with mental health difficulties around the borough.
And we quickly found that there are massive gaps. Gaps between people's needs and what's provided, gaps in communication between agencies, gaps in people knowing what help is out there for them, and also the long gap people experience while waiting for the treatment they need. For example, the waiting time if you've been referred by your GP for a mental health assessment is months. And that doesn't take into account the length of time it might have taken for somebody to realise there is a problem to go to the GP about in the first place. Now, we were told that people are assessed before they're put onto a waiting list, so the very urgent ones are seen quickly. All that means is that the worst cases, bluntly speaking, those who are in imminent danger of killing themselves, those get to the front of the queue, so everyone else is slightly less urgent, has to wait longer. It's a really terrible situation. And the mental health system is so stretched that the right treatment is not available when it should be. And this means that not only the person with the mental illness suffers awfully, but so do their family and wider society also. Then add to that, if you're suffering months on end with no sign of an end to it, no wonder people turn to drink or drugs in an attempt to lessen the pain they're in, or in other words, self-medicate. We heard from the police how a large chunk of their daily work is handling people with mental illness. What they are doing is picking up the pieces from an under-resourced mental health system. So what we have now is a system that's simply firefighting at crisis point, rather than providing either adequate prevention or early intervention.
We heard from our community inspirers how important prevention is and how intervention needs to focus on helping carers and families spot early signs of somebody becoming ill, to avoid things reaching crisis point. Talking to different organisations, we found that bringing people together around the table meant they could learn important information about what each other was providing, which they otherwise wouldn't know.
And we found it frankly shocking that there appeared to be a lack of joined-up working between some agencies. Indeed, one of our achievements as a PTC was to get 2 agencies around the table together who hadn't met each other previously. Our inspirers told us that if you have what's called a dual diagnosis, i.e. you are addicted to drink or drugs and you are also mentally ill, then you very often fall between two stools when looking for treatment. This needs to be addressed. But this is only one way in which the system lets people down. There's been an awful lot of attention in recent months, rightly so, about the divide between health and social care and how physically ill people fall between two stools in the services provided for them. And it's really great that in Cheshire West there are positive moves to get health and social care working together. It is also good to hear that the local health providers are working even closer, ever closer with the council. But that is only a start. That same working together needs to be happening between all those involved in providing both treatment and prevention for mental health. You've already heard a little bit, and you'll be hearing more by the end of this morning, about how the PTC has been a great transformative experience for our wonderful community inspirers. And it's good and right that we're celebrating that. But let's be really honest. A lot of the difference for them has come about because there have been people who know the system, who've heard through the Commission about individuals' predicaments and done something about it. For every one community inspirer who took part in the PTC, there are hundreds or thousands more residents in Cheshire West and Chester who do not have someone to fight their corner or to pull strings on their behalf. If only everyone suffering through poverty had access to someone who knew the system, who knew what's out there in the local area, and who could help people to navigate their way to the right agencies to help them in their need. Now, David's already mentioned about navigators, and there are people in this borough, you know, whose job is to do just that. They're called wellbeing coordinators, and many of you will not have heard of them, and the reason is because they're spread so thinly. There are only 15 across this borough, across the whole borough. Now, to have any meaningful effect, for people to know they're there in the first place, for them to be able to have really local knowledge, there needs to be loads more, at least 10 or 20 times that number. That requires a complete change of emphasis for those who hold the purse strings, not only at the council, but not only in the NHS, but together. Now, the reason I say it is not just about having compassion for the poor, which is of course something that's very important for me, that's God's priority, but it also, you know, makes economic sense. Because if you improve someone's well-being, they not only cost the system less in the long run through becoming healthy wage earners again, people can once more contribute back into the system. The size of the problems and the gaps in provision we saw as a subgroup could have exasperated us. But we decided to make some meaningful, if small, steps to begin to address these issues.
And now for some good news. By different agencies being part of the PTC, conversations were started, helping to improve a more joined up approach to delivering services. Plus, by having the benefits of lived experience in the room, we could tell them what it's like for service users' perspective. Information we gathered has helped to update local offer, an online resource provided by local authority that you'll hear more about later. Perhaps more important for most people to find out what help is available is a website called You in Mind, which we have helped develop in Cheshire West. And you'll hear more about this from Kate in a few minutes. In addition, some of the community inspirers have been advocacy training with Turning Point, who support people with addictions It will help clients at monthly drop-in surgeries, which will cover a range of services and advice, which may or not be directly related to substance issues. This will help with people make informed decisions about all aspects of their life. The Inspirers are also going to have monthly mentoring sessions with Turning Point staff as part of their ongoing development and capacity building.
One great way for people with mental health problems to get help is through peer support groups. And we were inspired by the way one such group works in Chester. It's called Chester Plus. A similar group is due to start next month for people in Northwich and facilitated by Groundworks. There'll be weekly drop-ins, and one of our community inspirers, Chris, will be volunteering there and helping to run the group. To help people understand more about mental health symptoms, training on mental health awareness needs to be more widely available for staff in public and voluntary sector organisations and in the communities. And we're very pleased that through the Building Futures project, a half-day mental awareness course is going to be delivered for up to 300 people, frontline staff in Ellesmere Port. But you know, mental health first aid training really needs to be delivered right across the borough. Healthbox are, for example, looking for funding to deliver such mental health first aid training in Blacon, which would also include family interventions and provide access to mental health services. But it won't happen without funding. Now, for a little more from Kelly.
I'd just like to tell you a little bit about my experience of being part of the PTC and planning to move forwards. The reason I got involved with the PTC was to feel like I had a voice, to have somewhere I could share my story and make a difference to those who have suffered like me. When I began my journey, it seemed like the first time in ages things were okay. Unfortunately, that didn't last long, but throughout my struggles over the past year, I've been really supported by the whole PTC team, which has been incredible. I've also had opportunities I never thought would become available, from co-chairing with the PTC, advocacy training, attending decision-making meetings and workshops, being part of the National PTC gathering in Leeds, and being interviewed for the Sunday Politics show. In addition to all of this, some of you may remember my passion for therapeutic dance and my involvement with Fallen Angels Dance Theatre. Unfortunately, due to deteriorating health last year at our PTC, I launched and performed my last ever solo, but I have always dreamed of helping others through dance, as I've been helped. Thankfully, due to successful joint bid between PTC and Fallen Angels, the Active Minds Investment Fund, my dream now has wings. We are calling this the Inspiring Angels Project. The funding will help me to train to facilitate dance movement workshops. I want to give people the powerful experience that I had through dance, enabling them to find connection and belonging through Fallen Angels family. As I mentioned, I'm currently unable to dance myself due to physical disability. However, dance is a massive part of my life. I've started visualising myself dancing. The body remembers emotions attached to the dance through muscle memory. So when visualising dance, it releases the emotions attached to it. The Inspiring Angels project will enable me to continue my dance through leading workshops and helping others through their journey. We also hope that through this project, other activities will blossom, like yoga, peer-led movement, cycling groups, walking groups, all for people with mental health issues, including addiction and recovery in the local area. We'll also have an accessible information folder at Story House, which will include any activities and groups in the area aimed at improving mental health and well-being for vulnerable people. If there are any organisations in this room who think they should be included in that, please let me know, or come to see me for a chat and find out more. Finally, I'd like to say that through the PTC I've made friends from far and wide, all with inspirational life stories. I'm proud to have them in my life. So far my journey's been amazing, and I'm looking forward to seeing the things we've achieved come to life. Please take a minute to watch a short film from our PTC journey and take care to listen to the poem I wrote celebrating our success, including words spoken by all community inspirers. Do you know what it's like to be me? Step into my shoes and through my eyes you will see. It started with a room full of people from different places and similar experiences. Apprehension filled the room. Each of us feeling unsure, not knowing what to expect. As a group, we continue together, sharing our stories, working together towards overcoming poverty. To question is to grow. If you never give up, you will succeed. I am rich in life, but I have no money. The dark finally lifting, freedom pouring in, dance, music, family support. No longer living only within. I am empowered, I am strong. Having our voices heard is powerful. Helping others through sharing our stories. I'm no longer a shadow of self-image. I masked so much before I became a part of something else. A willing to survive. Looking forward now, not back anymore. I have made positive changes within my own life. I am happy to be here and alive. Choose to be different. Choose to change. Continue to grow and learn, making positive change. Nothing about us, without us, is for us.